We're here to show you how to use the Corgrip NG-NI tube retention system. Before we start the procedure, it's important to note Corgrip's indications for use. The Corgrip nasogastric nasointestinal NG-NI tube retention system is indicated for use with enteral feeding tubes of 8 French and greater, and NG decompression, suction, and drainage tubes up to 18 French to prevent inadvertent removal or displacement of the tubes for adult patients. The Corgrip tube retention system is contraindicated for patients with facial or cranial fractures, nasal airway abnormalities, or obstructions. It should not be used for patients that may pull on their feeding tube or the Corgrip tube retention system to such an extent that it causes serious self-injury. The Corgrip package contains the following items: 1 white delivery catheter, 1 yellow retrieval catheter, 2 slot slide lock or SSL clamps imprinted with tube French size, 2 opening devices, and 1 package of water-soluble lubricant. Please do not exert force when inserting a catheter into a nostril. Using force or over-inserting the catheters may cause damage to the nasal cavity. Now let's begin the procedure. First, remove the clear protective sheath from the white and yellow catheters. Then, thoroughly lubricate both catheters with the water-soluble lubricant provided in the package. Avoid lubricating the magnet tips and umbilical tape. Begin by inserting the yellow retrieval catheter to the desired depth into the desired nostril. Then insert the white catheter into the opposite nostril to the same distance as the yellow catheter. Match the printed centimeter markings on the catheter to guide the insertion depth. The goal of matching the insertion depth is to align the magnetic tips at the same point behind the vomer bone. When the magnets connect behind the vomer bone, you will feel the connection and may also hear the magnets click. Some gentle manipulation of the catheters may be required for the magnets to engage. After magnet engagement has occurred, slowly and deliberately withdraw the white catheter until the umbilical tape is visible and the catheter is completely outside of the nostril. This step advances the umbilical tape behind the vomer bone and out of the opposite nostril. Withdraw the yellow catheter until the umbilical tape is completely out of the catheter. Disconnect the yellow catheter from the umbilical tape at the magnet and adjust the umbilical tape so that an equal length extends from each nostril. Now we will use the slot slide lock or SSL clamp to secure the tube. The SSL clamp allows for handling the clamp below the patient's nose and mouth. Take care or cover the patient's mouth when securing the SSL clamp. Slot the NG-NI tube into the groove of the SSL clamp. Then place both sides of the umbilical tape onto the flat area of the clamp in front of the feeding tube. Then slide the clamp to approximately 1 centimeter below the nostril and lock the clamp and umbilical tape into place by pinching the clamp closed. Be careful not to put tension on the umbilical tape or tube at the nostril. Secure the umbilical tape below the clamp with a knot. You can tie a double or triple knot with the extra umbilical tape. Do not tie the knots around the tube. Now you can trim the extra umbilical tape below the knot. Now that we have placed the Corgrip and secured the tube, we need to learn how to remove the SSL clamp and/or umbilical tape. To remove the Corgrip, you will use the opening device provided in the kit. Insert the largest side of the opening device into the small space on the clamp. While applying some pressure, tilt the clip slightly toward the back of the SSL clamp. You will hear a click when the clamp is open. If you want to remove only the Corgrip, open the SSL clamp and cut one end of the umbilical tape. Remove the SSL clamp and umbilical tape, leaving the feeding tube in position. Thank you for joining us today to learn how to use the Corgrip nasogastric nasointestinal NG-NI tube retention system.